Deviations of the forelimb and clinical management in cattle. Posture is the relation of extremities of the fetus to its trunk, the extremities being the head, neck, and legs. During pregnancy, they're flexed, and during birth, they're extended. However, the problems that can arise are carpal flexion, incomplete elbow extension, shoulder flexion, or foot nape, which is when the head is between the legs. It can be one-sided or double-sided. In carpal flexion, it happens in calves, but it's more frequent in foals. For the diagnosis, you'll see flexed joints, advanced, invaded, jammed in, or wedged in positions. For the prognosis, it depends how far the fetus is in the pelvic cavity. For the non-bloody method, cover the hoof with your hand and push the metacarpal dorsally and cranially. You can use chains or a snare to help pull it out. The bloody method is a partial fetotomy. In the case of incomplete elbow extension, the cause is traction, or a large fetus, or weak uterine activity. It occurs in calves, and the diagnosis is when the head is beyond the hoof. The prognosis, it's good if it's not wedged in. For the non-bloody method, push the head and pull the two legs. And the bloody method is a partial fetotomy. In the case of shoulder flexion, the occurrence is rare. It sometimes happens in small ruminants. However, it frequently happens in puppies and piglets. For the diagnosis, there's no legs in the birth canal. The prognosis is good if the fetus is small. For the non-bloody method, there are two phases: create a carpal flexion and then fix the hand. And for the bloody method, you can do a partial fetotomy. And for foot nape, this is when the limbs are covering the head. The cause is long limbs. It can occur in calves and small ruminants. For the diagnosis, the legs are above the head or the neck. The prognosis is bad. For the non-bloody method, push the legs behind the head. And for the bloody method, do a partial fetotomy.